Okay, recording. Okay, so when in extension, the articular surface is flat and have maximal contact with tibia, whereas it whereas the whereas in the flexion there is only point contact. Okay, not flat but round and point. Okay, so this is called as sliding and rolling. Femur rolls on tibia. Okay, so here is 1 2 3 1 2 3 and here is only 3 in the full flexion. Okay, you have to remember this. And the transverse axis around which these movements takes place is not fixed. That means during extension the axis moves forward and upward, and during flexion it moves backward and downward. And during these movements there is an automatic conjunct rotation of the knee. Okay, so medial rotation and lateral rotation occur along with extension and flexion. Okay, rotation of the knee, that is medial rotation of femur during last 30 degrees of extension, and lateral rotation of the femur during initial stages of flexion. When foot is off the ground, tibia rotates instead of femur but in the opposite direction. Okay, you have to remember this because this is the most important concept. That means locking and unlocking mechanism. Okay, we'll discuss that. Medial and lateral rotation, these takes place in the lower meniscotibia femoral compartment. Okay, these movements occur around vertical axis, and medial and lateral rotation usually occur with flexion along with. That is why they are called as conjunct rotation, but may occur independently if the knee is flexed. If the knee is flexed, then also medial and lateral rotation occur, that is called as adjunct rotations, especially when the foot is off the ground when we sit. Okay, the conjunct rotations play an important role in locking and unlocking mechanism. Okay, coming locking. So locking means when the foot is on the ground, the locking is defined as the medial rotation of the femur on tibia during the terminal phase of extension. When the knee is locked, it becomes absolutely rigid and all the ligaments of the joints are taut. This is known as screw home mechanism. Okay. So when the foot is on the ground, the locking is defined as the medial rotation of the femur on tibia. Okay. Medial rotation. This is very important. Medial rotation of the femur when the foot is on the ground. Okay. At the terminal phase of extension. So here remember, lateral condyle smaller. Okay, because it is circular in shape. Okay, lateral condyle of the tibia is smaller, and also lateral meniscus is somewhat deeper, and at the same time lateral condyle of the femur, lateral femoral condyle, is also smaller compared to the medial condyle. So what happens when in the extension phase, uh, before the full extension, when there is still extension happens up to the 30 degrees angle, these small tibial condyle and femoral condyle are become congruent. Okay, become congruent అంటే ఏంటంటే లాస్ట్ ఎక్స్టెన్షన్ చేసేటప్పుడు లాస్ట్ 30 degrees ఉన్నప్పుడే, అంటే ఫుల్ ఎక్స్టెన్షన్ అవ్వకుండానే lateral condyles, because of the lateral meniscus and smaller lateral tibial condyle and smaller femoral condyle, ఏమవుతుందంటే lateral condyles రెండు కరెక్ట్గా ఫిట్ అయిపోతాయి. ఓకే, కరెక్ట్గా దే ఫిట్ టుగెదర్ వెల్. ఎప్పుడైతే ఈ రెండు కరెక్ట్గా ఫిట్ అయిపోయినాయో ఈ 30% డిగ్రీ యాంగిల్ అవ్వదు, ఫర్దర్ ఎక్స్టెన్షన్ అవ్వదు. సో ఫర్దర్ ఎక్స్టెన్షన్ కోసం ఏమవుతుంది అంటే ఫేమర్ రొటేట్స్ మీడియల్లీ. ఓకే, బికాస్ ఆఫ్ ద దిస్ ఫ్యాక్టర్, because of the congruence happened in the lateral condyle. At the lateral condyle, femur automatically rotates medially. Okay, when this happens, that is called as locking of the knee, because in the locking mechanism, every ligaments are taut. Okay, so when the ligaments are taut, that means extension happens when the foot is on the ground. That means we are at the load bearing stage, weight bearing stage. So in order to facilitate the load bearing or weight bearing, this medial rotation happens, and when the medial rotation happens, the knee locks itself so that the all ligaments are tough and supports the knee joint in the load bearing. Okay, that is called as screw home mechanism. So when the knee starts to flex itself, okay, then it has to unlock itself. So this unlocking is uh, facilitated by popliteus. Okay, when the foot is on the ground, the unlocking is defined as lateral rotation of the femur on tibia during initial phase of flexion. So this so unlocking happens in the initial phase of flexion, whereas locking happens in the last phase of extension. Okay, locking is essential for weight bearing during erect posture. Okay, without locking we can't stand straight. Locked joint must be unlocked to facilitate progressive locomotion. During locomotion, locking and unlocking of the knee joint takes place alternatively and rhythmically. This is very important. Without locking and unlocking, we will never be able to walk on ground. Okay, medial rotation of femur on tibia during terminal phase of extension, brought by quadriceps, absolutely rigid, ligaments are tough. During flexion, initial phase, popliteus. Okay, you see. So flat surfaces of femoral condyles is in contact with tibia and stabilizes the knee joint. When it is locked, that means extension. In the extension, in the earlier pictures you remember, the articular surface is flat, thereby there is more articular surface. So the knee is fixed. Knee is fixed, all the ligaments are tough, and knee is strengthened and stabilized. Okay, so medial rotation of femur and tibia tightens all ligaments. Okay, whereas lateral rotation of the tibia slackens most of the ligaments. Okay, and at the same time, if you remember the last class on hip biomechanics of the hip joint, we say center of gravity. This is the line of center of gravity. Center of gravity passes anterior to the knee joint. Okay, though knee joint is weight bearing, it passes anterior to the knee joint and posterior to the hip joint. Review the biomechanics of the hip. Okay, so that because the axis of center of gravity passes anterior to the knee joint, and also during extension there is medial rotation of the femur which locks the knee. When every ligament is tough, then the knee helps in transmission of weight and also helps in erect posture. Okay, That is a knee. That's it. Any questions?